are now listening to A Potent Dose of Three with your hosts, Linda, Jasmine, and Kathy, and we're here to bring you your weekly dose.
Welcome back to part 2 of last week's episode. Let's get into it. But I saw this meme and I was like, 100%. It said, I cried because I wanted to get into med school. Now I'm in med school and crying. I would have been crying either way if I would have gone in or out. But at least I'll have a degree or I'll have something after.
Yeah, exactly.
I would have cried no matter what. So if we're going to cry, we're going to cry and get this MD title. So.
Exactly. Wipe your tears with your money. You better be crying broke and poor.
I mean, yeah, basically. Yeah. But yeah, I mean, no matter what, if I wouldn't have got in, I would have cried, and I would be crying for a while. And if I'm getting in, I'm going to cry. We're going to cry. There's going to be a lot of tears.
Exactly. It's okay. We're the potent dose of 3 cry babies. Like, it's okay.
Yeah.
It's normal.
Yeah.
And I know just like the process itself is of applying to med school is a journey, struggle, the interview process. And I would love for you to give listeners just that whole process.
Yeah. It is
like a breakdown of that.
It's a process. I hate interviewing. I'm bad at interviewing. I hate the camera. Don't like it. It bothers me.
There's gonna be
Oh, is it?
Of this part 2. I was gonna transition. That was me transitioning. So I was like, so saying part 2.
So let's go.
Yeah, because we're 35 minutes in.
Yeah, let's do it. Okay. So interviewing is really hard. It's something that's always been hard for me. I'm not sure if it's hard for you guys.
Yeah.
I hate it.
I don't like it.
I don't like talking because I feel like in interviews, they're always, well, for what I've been, because I know it's probably different.
There's going to be similarities.
Okay. So they ask like, tell me about yourself. Tell me about something unique about...
Girl, they don't do that type of interviewing no more for us.
No, but like when in my group interview, when he's like icebreakers or something, because everything counts.
The breakout room.
Yeah, but I feel like everything counts when an interview, when you start.
So what are you thinking?
Yeah, they don't ask those basic questions. They're not basic, but it's more so deeper. Like for us, they literally had us to run a health clinic. You are someone like within your community, a poor community. What type of health clinic will you build for this community? So that was one of ours. And then so we broke up in a group. I think mine was like a mobile clinic. So those who are unable to get to the hospital or clinic, we can go to them and stuff like that.
Got it.
Yeah, but I feel like...
They do ask that. She's being a hater.
But I feel like...
it's more in depth. That's just like the surface.
I just feel like once you start the interview, everything counts. Like you have... That's what I think. Like everything that you said, it has... This is what I think.
Yes and no.
Is there, you gotta impress, like you have to leave a mark so they'll remember you.
Yeah, this is true.
See, honestly, I don't remember them asking me, like tell me about yourself. But like I said, they put us in a breakout room with another person, like someone else that was interviewing, and that person like asked, like, oh, tell me about yourself. What do you do for your hobbies? And how they switched it around when we got back together with everyone. They say, oh, tell me about your partner. Yeah. So that shows, like, if you're listening to your partner, they're like, oh, what school did your partner go to? What school, when did they graduate? What are their hobbies? So that shows, like, your listening skills.
Yeah, but then for me, when I had that interview, it was hard because Thiago was a baby. He was months. So he decided to start crying right when the interview started. So Carlos had to take him out the house, and I was trying to listen to the girl because I knew they were going to ask.
Because they're doing it for a reason.
And now I wrote everything down because I was like, I'm not going to fail. And then that's how I was able to save it. But I feel like this is what I always thought of, that interviews are always very important and everything that you said counts and like how you say it, because you want them to remember you.
Yeah.
You know?
That's true. That's the one thing they did tell me is, because I remember being so nervous, I talked to my advisor and they're like, they already like you. You got to interview because they like you, but they want to know more about you. So when you answer your questions, you want to make them very personal. So you want to tell a story, basically. So, like when you're interviewing, I did MMIs for a lot of my interviews, which are multiple mini interviews. And so basically they can ask you anything. Like I remember they can ask you, I'm not going to tell you guys specific things that I got interviewed on, because I'm not allowed to. I signed like non-disclosures and stuff for that.
Yeah, I don't know if I did.
Oh, you can go for it. But basically, like, they can be like, tell me about yourself. They can ask you about your extracurriculars on your application to elaborate. They can give you like ethical scenarios. So I remember like one of them was, you're a physician at a clinic, and these parents come in bringing their 14-year-old daughter who, when the parents leave, asks you to get on birth control. What do you do? And she asked to not tell her parents, what do you do? So then so now how do you answer that, right? Like, so you have to practice a lot of ethical stuff, because they're going to ask you something random like that.
Which is good.
And are these MMIs just you and the person interviewing you, or is this a group interview, or how does that work?
So depending on the school, there'll be different MMI stations. Like some you'll get 10 stations, some you'll get 5 stations. And so when you're doing that multiple mini interview, it's one person. Okay. And then once you answer, there's another person. So you have like, depending on how many stations you have, you will have like 10 or 11 different people.
But they're interviewers.
Interviewing.
One person at a time.
Okay. And this is all through Zoom?
Some are through Zoom. Some are through like some specific websites that they have. Some of them like are really cool, and they'll tell you like the time. So like you have to log into the station at 11:55, and the next station doesn't start till 12:05.
But none of them were in person.
No, none of my interviews were in person. Okay. But anyways, I remember like really struggling with how to answer multiple mini interviews, because first off, I don't do well in interviews, and there's actually a process to how you're supposed to answer them. And so one of the first things you want to do is restate the question. And then after that, you're going to answer the question, and you're going to tie it in with a story, and then a story that you've experienced or that you've done, like within clinical settings or within your extracurricular activities, or a job that you've had. And then you always want to tie it back to medicine and like how it will present as a physician. Mm-hmm. So that's something you want to do.
Are your answers timed? Like, do you let's say like you have 5 minutes to answer this question?
Yeah. So what you'll do is they'll depending on the school, they'll either read you the question and you'll take notes really quick to like what they said, so you'll know what you're going to answer. Mm-hmm. And then after they read you the thing, you have 2 minutes to think about what you're going to say. Mm-hmm. After those 2 minutes are up, their screen turns, like you can actually see their face. You can actually see their face now. And then you have 5 minutes to talk. You just talk nonstop for 5 minutes, which is hard to do.
That sounds nerve-wracking, dude.
It's hard to do. I remember having my phone on and the timer, and making sure that I was going to be talking for 5 minutes, trying to stare at the camera, but also trying to see how much time I had. And if I didn't have enough time, I'd have to keep talking. Yeah, it was really hard. And then if you didn't talk for the 5 minutes, then they would be like, they'd have a follow-up, and it would make it even more complicated. So you wanted to fill up those 5 minutes, because if not, they were going to be like, well, what if this happens? Like they make it tricky.
Don't give them no time.
You want to finish those 5 minutes for sure.
Dang.
Yeah, it was
stressful.
Yeah. So nerve-wracking. Yeah.
Okay.
Yeah.
So so you prepare for the MMIs. MMI is done. It could be 10 stations, it could be 1 station, right?
Yeah, it could be like 5 stations, 10 stations. I think I've only heard of like 11 or 12 stations, up to 12 stations.
How long did it take you to prepare yourself for this when you have like an MMI? How long do you give yourself to prepare for this type of interviews?
Oh, I was preparing every day, morning and night, because I knew this was a weakness. This is one of my biggest weaknesses. Mm-hmm. Interviewing is my biggest weakness. I don't do well. I get nervous. I forget what I'm gonna say. So what I did is I prepared morning and night, but I was like, I don't know what they're gonna ask me, right? So I went onto like websites like Shemasian and BMO, which we'll link in the descriptions, but basically they have like a bunch of practice questions you can do to practice. I timed myself. I had someone else time me. I had someone else read me the question and me practice like giving the answer.
Yeah, everything is a practice because
Mhm.
I remember you even mentioning that even you, like in the beginning, you mentioned you do not like being on camera.
Mhm.
I don't know who told you this, but they were like, I can see you looking away from the camera. Like,
Mhm.
look here.
Mhm.
So that's even, you got to
To
practice
this day,
that.
I still don't look at the camera here.
Yeah.
And we're like almost 60
It's like-
episodes in.
Yeah.
little things.
Yeah, I don't like the camera. So what did I have to do? I had to, like, when I was practice interviewing, even though it was I just practice interviewing with my boyfriend or with someone, I would put a camera there to make me uncomfortable, so that I would feel like I'm
okay.
like, you know, talking to a screen,
Mm-hmm.
and that helped too because I was able to see like my weird mannerisms and things like that. So
That's one thing. When you record yourself, you just notice things that you never would have thought. Because
yeah.
even with this, I'm like, oh, I talk with my
Why'd
hands
I
a
do
lot.
that?
Mhm.
Yeah. Why do I blink like that?
Yeah. So annoying.
What else did I do? And then like I did my best too to try to be like, what is important? Like what would they want to know about me?
Mhm.
And it's what are my weaknesses? What are my strengths? Maybe like how do you work in teams?
Mhm.
That's important, right?
Yeah.
Right.
that's
Telling them a time where I messed up. You know, I came up with I made like a cheat sheet kind of, and be like, okay, weaknesses, and I would put weaknesses, and then I would put a story with my weaknesses. Like you had to come up with a story for every answer. So every answer, like, tell me about a time you made a mistake academically. Boom, I put in my undergrad experience. Tell me about a time where you took on a leadership role. Maybe a time as an EMT where I worked with a EMT partner who didn't have as much experience, and then I had to help them through something.
Mhm.
So like having stories for everything really helped when they asked me something and I didn't like prepare for it. I'm like, oh wait, I actually have a story for that.
Yeah.
Which was really helpful.
That's
important.
good,
That's
yeah.
important.
That was really helpful.
Yeah. How do you feel about creating like a PDF of just the questions, and if whoever needs them, they can like DM us or something?
Yeah, I actually already did it. Yeah, I already did it.
Oh, made the PDF?
Mhm.
Oh.
Yeah, I have with questions. Yeah.
So if you guys want these questions, make sure you follow us first. And then DM us at a potent dose of 3 on Instagram.
Mm-hmm.
Yeah.
Another thing I think is really important too, when you're going into interview, they want to see that you possess certain qualities, right? So like when you're applying to medical school, there's these things called the AAMC competencies, and these are basically things they're looking to see if you have. Do you possess leadership? Do you possess the ability to are you resilient? Like, are you able to get back up when you've made a mistake, or when things didn't go as planned? Things like that.
Yeah.
So like if you look at the competencies and try to come up with a question with those, you're good.
Okay.
I think you're good.
Okay.
Yeah.
So what other kind of interview? Because I know you've told us before that you have MMIs, and I thought it was another
Traditional.
Yeah. So how do you prepare for that? Because I know you said you train with like someone, I don't remember, but yeah, how do you prepare for the traditional interviews?
For the traditional interviews, I did stuff like kind of like, why would I want to go to that school, right?
Mm-hmm.
And it'd be like, why would you want to go to this school? And then I would look for things that I liked about that school. So when they asked me, I could bring up programs in their school so they could be like, wow, she really knows her school.
Okay.
You know what I mean? So I would have a cheat sheet. Like if I was going to interview for UC Davis, right?
Mm-hmm.
I would have a cheat sheet with specific programs I loved about their school.
Mm-hmm.
Or why are you a good fit? Why am I a good fit? And I would try to tie in like their mission statement. Be like, what is their mission statement and how do I fit into that mission statement? And try to come up with examples so that way when they asked me, I already had it. It was ready to go.
And that shows the importance of doing your research.
Yeah.
You can't be lazy. You have to do the research behind it. Learn about the school.
Mhm.
Because I know with med school or any school, it's like when you're applying, sometimes people just want to apply because they want to get accepted into somewhere. But if you don't know about the school, and you'll just be thrown off if they ask you a question like, oh, like what do you like about our school? Like if you do your research, you'll know how to answer those questions.
Yeah.
Even when you write the personal statement for the school,
You should.
they
yeah.
love to see like their mission, their vision.
Like,
How
I
would
relate
that
to this
connect-
because
yeah, how that
I
connects
that
Yeah.
you have
with
this.
you.
Yeah.
And I will say that if you're going to go into the interview, I would read everything you wrote for them because they might ask you to elaborate
Oh yeah.
or follow up on it or ask you other questions. And if you don't remember what you wrote for them, I don't think that looks
That
good.
don't look. That would not look good.
Yeah.
At all.
So for the interview process, what comes first? The normal interview and then the MMIs, or the MMIs and then the normal interview?
Or does it depend on the school?
Some
Yeah.
you'll get only an MMI. Some you'll get scratch that. I think for all of them except for one school, I got MMI, traditional, and I got like 3 interviews for one school.
What was the third interview about?
Student interview. The students interview you. So like medical students.
Wow. So nice.
Mm-hmm. Like first years will interview you.
Wow.
Mm-hmm.
That's cool.
Do you feel like from when you got your first interview till now, have you like
I've gotten
evolved?
super. Yeah, I remember the first interview. You were there for the first interview.
Was that Charles?
Yeah.
Oh,
Yeah, the first school, I was so nervous. I was
Yeah.
shaking. I was shaking. It wasn't, the first interview, I had tech issues.
Late.
I was late to it because of tech issues. I missed an email from the school, or I didn't get it. I think it went to spam, so I never got it, and so I missed it. So I was totally unprepared for it, and I kind of botched it. I'm not gonna lie, I botched the
It
first.
threw you off. I would have been thrown off
It
too.
threw me off being late, because if you know
Yeah.
me, you know I hate being late.
Yeah.
I like being early.
Mm-hmm.
And so I was late. We weren't able to finish my whole interview,
Like
so
cut off mid.
so we
she was
rushed
talking.
it. And then I went into the second interview all like depressy because I messed up the first interview.
Yeah.
Lord.
But they let me redo it, and that went a lot better.
Oh, yeah.
So that one was not the best interview. Second interview, a little better, but still not good. Third interview, a lot better. Fourth interview, the best one.
So you had a total of 4 interviews?
Yeah.
Okay. Not bad.
Which it was crazy. I'm glad UC Davis saved me for last, because we got it done after messing
That's
up
when
so
she
many
was
times.
ready.
Yeah. Only that one.
Yeah, the last was the best one. So
Mm-hmm.
there was definitely progression for sure.
For the student interviews, were there any things that you did to prepare for these student interviews? Are they different from the normal from the traditional interviews, or?
I would say that I feel like when I did the student interviews, I felt a lot more relaxed, because I knew it was just students, and they're not judging you as hard. So if I were to suggest something really quick before I answer that, is if you can choose the way you can, because sometimes you can choose what interview comes first.
Oh, okay.
I chose to have my medical school interview first, so I can relax.
Okay.
So I can start off like easy, and then it got harder and harder. So I was like building up. But for the student interview, they're probably gonna ask you like more personal stuff, like tell me about yourself, tell me about this, tell me about that. You know, I would say they would want. And then also, I think it's super important, always make sure that you come in ready before that interview with questions about the school, because it shows that you really want to get to know the
So
school.
you always have questions.
Mhm.
Definitely always have questions.
Mhm.
Even for a job interview,
Yeah.
have questions.
Yeah.
Because they're going to ask, like, oh, do you have any questions for me? You don't want to be like, oh, no.
No.
Yeah. Yeah, always have a
Ask
question or
questions.
two to ask.
Yeah.
But yeah. What else?
Was there so can it be this scenario where they ask you like an MMI question and you truly don't have any answer?
You have to have an
Like
answer.
you have wow.
Have you been in that position? And then if so, how did you deal with it?
So I heard that it's not necessarily your answer. They just want to see that you're thinking things through, taking things into consideration. Do you want me to like do the one that I said, the question?
Yeah.
Okay. So you're going to be like, I'm going to restate it, right? So I'm going to be like, okay, just if I'm understanding correctly, I'm a physician and I have a 14-year-old patient who wants to get on birth control. However, she doesn't want her parents to be informed. And honestly, this is a really difficult situation to be in. I do understand that the parents, are trying to care for their daughter and do have their daughter's well-being. They're considering her well-being. However, I think what I would want to do is make sure that I have a private conversation with my patient in private, ask her why it is she wants to get on birth control, making sure that she knows what getting on birth control entails, just making sure that she knows that getting on birth control does not prevent her from getting STDs or STIs, and just giving her a better understanding of how birth control works, and also being able to, you know, just ask her if she is the one that wants to get on birth control, or making sure that no one is making her get on birth control, and just making sure that she's deciding this for herself, and just ensuring that she understands, you know, that there's a possibility that she still may get pregnant. So just like informing her of things, and also letting her know that she's not protected from STDs or STIs. I would also want to talk to her parents and just get an understanding as to why they don't want to get no, scratch that. You don't want to talk to the parents because she doesn't want
Yeah,
sorry. And so after talking to the patient, you know, I would want to treat my patient, and so I would offer her the medication and not inform her parents, because as my patient, you know, I want to protect her privacy and things like that. And then that's where I'm going to bring in a story where I saw where maybe like my patient wanted something but family members wanted something else. Yeah. Mm-hmm. So like an example of like a DNR, which I would put in there. Right. And then after that, talking about how this was an important lesson, the story was an important lesson because it taught me that a lot of times I'm going to have to make difficult decisions where people are not agreeing. And so being able to, you know, talk through the situation and ensuring that people are informed is something that I'm going to want to make sure I'm able to, you know, do, because this is going to happen a lot working in medicine.
Right. And is in the state of California, we are able to prescribe medication or birth control to a 13-year-old.
Yeah.
And that's another thing, is like you need to know your laws.
Yeah.
Because like
sorry.
Here we're able to. Oh no, you did great.
Oh no, that was a great answer.
Yeah. I was just saying too, like the state of California, because what about we're like in Texas or somewhere?
Yeah.
Like, I'll give you birth control.
They'll ask me some. I remember seeing one about like a blood transfusion, and where like the parents didn't want to give their child a blood transfusion because religious purposes, you know.
Yeah, I feel like
even if you have to come up with the answer.
Okay.
And so something that is really important when you're doing an MMI, just remember, thank you, Kathy, is you want to, I mean, it's important to use certain keywords like acknowledging the difficulty of the situation. Because now you're saying that you understand the parents' perspective, but you also understand the patient's perspective. Saying that you want to approach the situation, which I didn't do, empathetically or compassionately. Pulling the patient to the side and talking in private. That's super important to do. You don't want to just bring the parents in when she's asking for privacy. Gathering more information or informing people of certain things, things like that. Certain keywords that are super important that they're going to be looking for.
Yeah, pretty much.
That sounds very... That sounds like a very good answer, because even
I forgot my bad.
As I was listening to it, I was like listening, and then I'm like, okay, she's talking about educating the patient. She's talking about like
the safety,
safety. She's talking about her privacy.
Mm-hmm.
I'm like, this is a great, like, you were touching very good points, even though I'm not an interviewer, but I'm like, just knowing things that, you know, like,
you hit every point.
Yeah. So you just want to make sure that they're seeing your thinking, like. Even though you don't know the answer, you kind of have to like figure it out by being like ABC. Like you want to just pull stuff in, gather information. You don't know the answer. Even like talking to your colleague, they love when you talk to your colleagues because it shows that you work as a team.
As a team,
you know, things like that.
Yeah. You can, if you didn't know, it's like you say everything that Jasmine said or some of it, and like, oh, but then I'll follow up with my colleague to see if this is the best choice or course of action for this patient, because something like you don't know everything, right? So you need to get like a second opinion from someone.
They love when you get work with people. It shows that you're not just, you work as a team. You're taking your patient's health and into, you want to make sure that you're doing everything possible to give them the best care. And so you do what you got to do. If that means, you know, consulting with your peers or your coworkers or your colleagues. They like that stuff.
Pretty much. So. How did you show up for your interviews? Like, how did you dress? Because you'd be surprised. Not everybody know how, like, what clothing to wear for interviews.
I wore a jacket, like a blazer. Mm-hmm. I wore a nice, like, cream top. And I did wear lipstick because I wanted... I don't know if I honestly don't even know if that was like appropriate, but that's just who I am. So I wore this lipstick.
A pop of color.
Yeah, I wanted them to know my lips. I don't know.
Yeah,
I don't know.
It's pink. It looks red on camera, but it's pink.
Yeah.
Pink.
They said that you're supposed to dress like head to toe because if you get up and they see you, that doesn't look right.
It threw you out, yeah.
But I didn't.
Yeah. I'm like, I probably wouldn't either.
But yeah, I think I wore a jacket I think I wore a blazer every interview because I feel like it just looked the most professional.
I feel like, it puts the outfit together.
Mhm.
When you have a blazer on, honestly.
Yeah. I made sure my hair was nice in a braid, and yeah.
Take your time.
I tried not to put too much makeup, like besides the lipstick, like too much makeup on my face.
That makes it. Yeah, that's good.
Yeah. What else?
What else?
I'm trying to think what else is super important.
Did you already answer like what was the hardest part of interviewing? Or what is the hardest part for you? Did you ever have like connection problems or
That one
noisy
time.
neighbors?
No, with the first interview I had tech issues and then my thing went to spam, so then I was late.
Mhm.
All of that happened. And I guess for that, I would just suggest like letting them know it happened and seeing if they can reschedule or accommodate a new interview date.
Yeah.
I
And
think
if
it's
you
super
live
important.
in a house with a lot of people, have your family members or someone just go out for the day. Say, this is a very important interview. Can you please allow me to be here at home by myself while I'm taking the interview?
Yeah.
Make sure your connection is working. Make sure like you have the softwares that you need it downloaded because you don't want to log on the day of the interview. You don't even have Zoom downloaded.
Yeah, I would
or whatever
say
it is.
even just telling people the day that you're interviewing, because I think my mom has done this a few times where I've been on Zoom and like she'll yell for my name and I can hear her from the window. She yells at me like, and I hear her outside. And so I knew that might happen. So I was like, hey mom, I'm interviewing this day. So she wouldn't yell at me
Mhm,
while I'm
that's what I'm telling
interviewing.
Yeah.
Yeah. Yeah, that's really important. Or even like Jonathan, I told him like, if you're going to work, leave through the back door. Don't leave through the front door. Because if I see you, I don't want to.
Yeah,
like,
your
get
eyes will
distracted,
follow.
right.
Yeah, I don't want to get
everything.
distracted. So
And how long are these interviews?
they all are different. Like one of them was
Give me the range.
One of them was 3 hours. That was my longest interview.
Mhm.
Like
What's the
a
shortest?
traditional interview or just with the
MMI.
MMI?
MMIs and stuff. 3.
But was that included breaks and everything?
Yeah. Mhm.
Okay.
How many breaks did they give you?
So it was like MMI break, MMI break, but it's like I think you get like 5-minute break in between each one. I think so. MMI break, MMI break, MMI break,
Mhm.
and then like when you come in, they're probably gonna describe the process, right? So in the beginning, when you come in, you all come into one Zoom, and then there they'll explain how it goes. So maybe that's like 30 minutes of them giving you directions or instructions and things like that.
How many people did they interview per interview? Like, what was the range of people that you saw?
I think the highest I saw was like 10.
Oh, okay. I
Yeah.
thought you were gonna say like 100.
No,
So you're
imagining,
able
like,
to
big
see?
groups.
I thought you wouldn't have known.
Because when you come into the info session, you see everybody there.
Yeah. But
So you see everybody there, and so like maybe up to 30 because there's different like sections where they move you around. It's weird.
So prior, before you even interview, they have an info session breaking down how the interview is ran.
Yeah.
And then you go into the interview.
Yeah, and they'll
Okay.
because they'll be like, oh, if you have any connection issues and you're not able to log into your MMI, come back to this and let us know. So you're not gonna do it, but then after everyone's done their MMIs, you can come back and redo the one you weren't able to do.
Okay.
Oh,
Yeah.
that's good.
Yeah,
They give
Okay.
you that option.
yeah. So like they work with you. They're not trying to like make it hard for you.
Oh, that's good.
Yeah. To prepare, I did seek people out. I was trying to have anybody I knew to interview me. Anybody. Even if I didn't know them. I remember I did this MMI, and I've mentioned this before, but I did this MMI with one of my advisors, and the people she hired to do the MMIs, they were so sweet. And they were just like, let us know if you need any help. And so I reached out to them and I was like, I do need help.
Yeah.
And they did it with me. And so-
Also, it sounds like your advisors had a huge like impact on like you applying to med school.
Oh yeah.
So I'm like, I don't think that's for everyone, but if you couldn't get an advisor, do that.
Oh,
because your advisor was because of your post-bac program. So imagine if you didn't go to post-bac. So what do? How do you find an advisor?
So this is not an ad, but my advisor used to work for UC Davis, right? But now she has her own company that she started.
Oh yeah, you should like tag her.
Yeah, her own company. It's My Honest Advisor, and she knows her shit. She knows what she's doing. She's the one that like taught me that there's a way to answer. You know, like you need to restate, you need to answer, you need to tell the story. She has a website. She helps with interviewing. She helps with primary applications, secondary applications. She helps with pretty much all of it.
That's important to have.
Yes.
Honestly, I know like sometimes it can get pricey, but I would say that is a good investment that you should probably do, because they know little tips and tricks that are actually super important that I didn't even realize are important. Like one of the things they told me, they're like, okay, you interviewed, now what?
Yeah.
Now what, right? I would have been like, I don't know, I'll just wait. That's what I would have said.
Send those emails.
They said you need to send emails monthly, being like, hey, I'm still here. This is what I've been doing.
I really enjoyed your school, and I'm still waiting.
First, you'll be like right after you'll send a thank you for the interview. And then like a month later, you'll send a, hey, I'm still waiting. I'm really interested in your school. This is what I've been doing since then. Things like that. Keep them updated on your life.
Yeah, so they can know, so they won't forget about you, basically.
But some schools don't accept updates, so just make sure that the school you're trying to update
read about the school.
accepts updates, because you will make them angry.
Yeah, they're like, yeah, just reject.
Yeah, not gonna lie, there was one where I updated them, and then right after I updated them, they rejected me. I was like, damn.
They were like, she don't follow directions. It said clearly in the emails, do not email about updates on the statuses of your application.
Hold on. It did say that, but it also said, don't email for updates, and then right underneath it said, they had a box and it was like, this is for updates. And I was like, so do you want updates or do you not want updates?
No.
And I was like, do you see how that's confusing?
Yeah.
And I was like, I'm just gonna send an update, because if this is here, like they want me to. And so
So how much did you have to pay for your advisor?
I didn't pay because it was through my program. Because it was through my program, it was all included. But if you don't do the program, then you do have to pay out of pocket for the advisors.
But was it because she was doing it because, you know, the kindness of her own heart? Because she doesn't work for that university anymore, right? So did she, you know, like, because you were her student prior, did she just like, oh, I'll help you?
Yeah.
Because I got accepted into the school when she was still teaching there. And because I heard that a lot of people got into this program specifically for her.
Oh, so they're like,
and so after she left, she still like was allowing us to still, you know, come see her and things like that.
Oh, that's good.
Yeah, that was nice of her.
Yeah,
Do you know how much her rates are without being a part of the post-bac program?
No, but if you go to her website on My Honest Advisor, like on her website, she has the rates. They're different rates. Like I know you can buy like a complete package, or you can buy certain packages for certain things, like just interviewing or just editing, like your writing or things like that. So there's different packages you can get. And then she also has Instagram. So like, let's just say you don't have the finances to be able to purchase her packages. She also gives really good advice on her social medias as well. So.
And I don't know if you mentioned this last episode or some episode, there's someone that gives like a free workshop.
Oh yeah. Mi mentor.
My mentor. But it's spelled MIMENTOR.
Yeah, I think it's MI and then it's space.
Mentor.
Yeah.
Okay.
And so they offered free MMI workshops as well. And I thought that was really useful. You just sign up, you don't pay for it, and you'll go through the process and you'll just practice doing MMIs. And they hold multiple ones.
Oh, that's good.
I didn't know.
Free.
I was like, because after I was like, oh, this was so helpful. It really was helpful. I was like, this was so helpful. Do you guys do this often? They're like, yeah, actually we did one last week. And I was like, oh. Everyone else knew it. I was like, oh.
Yeah, so using those free resources.
Yeah, so getting and looking and finding those resources is really important. Make sure I mean, the process of applying is super expensive, so just make sure that you're finding free resources if you can. And I would say, if I could give any advice, is just, especially if you struggle with interviewing, don't be scared to ask people for help. Don't be scared to ask for them if they can interview you or do practice interviewing, because for me, that was the biggest, I think, help in getting better at my weakness. So, with that being said, all of the websites will be linked below in the description. And if you have any other questions about the interview process, don't be afraid. You can email us or send us a message on IG.
Yeah, and if you want the questions that she used to prep, DM us on IG. But first, follow. If you don't follow, you're not getting the questions, baby.
Bye.
Thanks for listening to this episode of PD3 with your hosts Linda, Jasmine, and Kathy. Make sure you like, comment, and subscribe at a potent dose of 3 so that you never miss an episode and your weekly dose.